Hello, everyone. Hello, and welcome to the SMP Senior Medicare Patrol podcast, Sip and Learn with SMP. Thank you for joining us today. I am Johnetta with Senior Medicare Patrol. I am the Complex Interaction Specialist for Georgia, Louisiana, Mississippi, and Vermont. So today we're going to talk about the SMP program, who we are, what we do, and we'll also give you a general overview of our program as well.
And I'm Renee, the Community Outreach Specialist for the Mississippi area. And before we get started, I do need to let you know that this is a project supported by the Administration for Community Living, U.S. Department of Health and Human Services, as a part of a financial assistance award with 100% funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by ACL, HHS, or the U.S. government. Now let's get started. Janetta, what is Senior Medicare Patrol?
Thank you, Danae. That is a great question. So, Senior Medicare Patrol, also known as SMP, is a federally funded nationwide program. Our goal and our mission is to empower and assist Medicare beneficiaries, their families, and caregivers on how to prevent, detect, and report healthcare fraud, errors, and abuse. And we do this through community outreach, counseling, and education. So this means we'll be at senior centers, we'll be at health fairs, anywhere seniors are and seniors congregate or Medicare beneficiaries. We want to go out and give them the message. So that's an overview of like our mission and the definition of who we are. So Danae, give us information on what does Senior Medicare do? What is our role?
That is a really good question. And so we, as a community outreach specialist, as you stated, we do go out in the community and spread messages to different audiences. We do presentations and attend health fairs and health expos. We reach out to senior centers and senior organizations. We participate on panels that invite us to talk about healthcare fraud and scams. We also do radio and TV shows. Anywhere where we're able to get our message out, we try to take advantage of those opportunities to present our message and ensure that people are aware that our program is out here to help people. We let people know that we are a resource in the community in case they become a victim. And if you want to report something that you suspect as fraud, give us a call. That number that you can call is 877 272 8720 to report it. So now that we've talked a little bit about what Senior Medicare Patrol does, Janetta, can you tell us what exactly is healthcare fraud?
Absolutely. So healthcare fraud, well, let's just do some examples. What an example of healthcare fraud would be. If a person is billed twice for an item on their Medicare summary notice, or maybe they're being billed for an item that they didn't even receive, or it could be they're being billed for services not ordered by their physician or any physician. Those are just a few examples of healthcare fraud. Also, the phone calls. When someone is offered a free back brace or a free knee brace and their Medicare number is needed, we want our seniors and our beneficiaries to know that, to be aware of this. The marketing tactics that are being used are confusing, and the Medicare beneficiaries could easily give out their personal information as well as their Medicare information. Remember, never give out your personal information to anyone, especially over the phone. Medicare does not call, and no one should have that personal information. So, Danae, tell us, how can I find out if my Medicare number was stolen or if my Medicare number was compromised?
That is a really good question. So, to find out if your Medicare number has been compromised, start with checking that Medicare Summary Notice or MSN. Also, you can check the Explanation of Benefits or EOB if you received one of those. We teach our Medicare beneficiaries to be proactive. We teach them to look for errors and inconsistencies on their Medicare Summary Notices or Explanation of Benefits. We ask them to check to make sure that their name is listed, their address, and their doctor's information is not only listed but correct. There is, this is normally where you can find those inconsistencies or those errors that we were talking about. When you receive those statements, we ask Medicare beneficiaries not to throw them away because it says on the statement, this is not a bill. We tend to want to throw them away or discard them. We ask that one keep their statement just in case they have to refer back to it in the future. Other important things to check for on that MSN or EOP would be being billed for items that are not received, billed for items that have not been requested, and also being billed for items that they did not order. So check over those statements and just make sure that everything is correct. If you have questions, give us a call at our toll-free number, and that is 877-272-8720. So, Janetta, can you tell us about where they can call to report healthcare fraud or a compromised Medicare number, or even scams, waste, or abuse?
Absolutely. So to report fraud, waste, and abuse, you can call SMP, that's Senior Medicare Patrol. If you do have questions, maybe a question about your billing statement, if you think you've been a victim of healthcare fraud, or if you think your Medicare number has been compromised, you can call our toll-free number. It's our toll-free hotline. The number is 877-272-8720, Monday through Friday, 8:30 to 5 Central Time. You can also visit our website, and we also have a Facebook page. If you're listening to this podcast and you don't live in Louisiana, Georgia, Mississippi, or Vermont, you can contact the SMP National Resource Center at 877-808-2468. Or you can also go to the website smpresource.org, and they will connect you through to the National SMP hotline to your state's SMP program. Okay, Danae, is there a charge for SMP to help victims of Medicare fraud? Are we charging people?
Well, actually, to answer your question, no. There is never a charge for SMP to help you. We are federally funded by the government with a grant. So, this allows us to go out into the community and spread the message on how to protect Medicare beneficiaries and the Medicare program from fraud, waste, and abuse. So, Janetta, can you leave our listeners with the three keys to prevent Medicare fraud?
Sure, our three key prevention tips. Now that you're familiar with the SMP program, we want to remind everyone of our main Medicare fraud prevention tips, and they are prevent. Prevent your Medicare card and protect your Medicare card and your Medicare number. Treat it like a debit card or treat it like a credit card. Then there's detect. Keep track of your doctor's clinics and hospital visits and compare them to your Medicare summary notice or your explanation of benefits. The statements you receive in the mail are very important, so we do want you to go over that information. And last but not least is report. If you detect something on your Medicare statement that is not correct, report it. And you can do that by calling our toll-free number. That number is 877 272-8720. So that was prevent, detect, and report. Those are the three things or the three prevention keys we want you to remember. Okay, so that was a little bit about a little information about our program and what we do. We want to thank you for tuning into this episode. We hope you join us again for the next episode of Sip and Learn with SMP for more information on SMP content and on new topics. So thank you, Danae. We appreciate it.
Yeah, absolutely. Thank you. Thank you. I appreciate you and all that good information. And we'll see everybody next time.
Okay, bye-bye.